Welcome to Active Aging. My name's Danielle Procopio and I'm your host. And this month I'm very excited to have the team from Harbor Light joining us to tell us a little bit about palliative care. So thank you ladies for coming.
You're welcome.
We have
Thanks for
Diane
having us.
Garthwaite here.
Yes.
You're our community relations liaison for the area.
That's
and
it.
then Tina Femia, and you're their nurse practitioner, correct?
Correct.
Tina, how long have you been with Harbor Light?
For about 3-4 months now.
Oh, so you're a new addition to the team.
Wonderful
Excellent.
new addition.
And Diane, you've been here for a long time.
3.5 years.
Already.
Yeah,
Oh my
already.
gosh.
Yeah.
Very good.
Yeah, it's been
So
wonderful.
it's been great for us because we've known each other a long time. And so as palliative care was kind of being introduced by Harbor Light, you
Right.
were a part of that
Yes.
introduction.
Yeah. You guys
So
were.
I'm really excited to have you today to talk a little bit
Thanks.
more about what you guys are up to.
Happy to be here. Thanks for
Very
having
good.
us.
Of course,
Yeah.
of course. So for our viewers that might not be as familiar with healthcare as the three of us are, can you tell us a little bit about what is palliative care?
Palliative care basically is for patients who are suffering with a chronic illness, or maybe more than one chronic illness, maybe several different disease processes going on at the same time. And what happens with palliative care is we try to while you're still aggressively treating those disease processes, we go in and try to help the patient get the symptoms under control.
Okay.
It could be fatigue, it could be pain. The majority probably is pain.
Anxiety.
Anxiety, depression, nausea, whatever the disease process, whatever the symptoms are that come along with the disease process. And so that way, if you can get those symptoms under control, a lot of times you can, it's easier to fight the disease because you have more stamina,
Sure.
you have more, you're not as anxious, you aren't tired. You get the symptoms under control, it just gives you the energy and the more comfortable you are, the better off you're going to be to just treat the disease.
Absolutely.
And, get those symptoms out of the way, basically.
Very good.
Yeah.
Now, I think that sounds like a great program, and I think that a lot of people could probably benefit from helping with symptom management.
Right.
So what types of patients would qualify to have palliative care? So if I'm watching at home, how do I know if I'm appropriate for these types of services?
Pretty much anyone with any kind of chronic illness. Your patients who have lung disease or COPD, your heart failure patients, or any cardiac issues, liver disease, dementia, patients with MS, pretty much all qualify. And then also, those patients who are having some changes in their illness. You think about palliative medicine, for instance, if they're having weight loss, if they're having a more difficult time with bathing and dressing, and there's been some changes. People who are facing treatment options and they have a lot of questions. A lot of times our patients are deciding whether, should we go, if they have cancer, what happens if we go through chemotherapy, the pros and the cons, or questions about feeding tubes, those kind of things. So we help answer those questions. And, not only do we answer the questions for the patient, we look at the entire family unit. We talk with the families. A lot of times, patients, especially like are in the hospital, they have those questions, but it's hard to get the entire family unit together.
Sure.
So we take time to do that because we feel like, a patient who is well informed about the pros and cons of treatment, it's a better way for them to decide whether they want to proceed or not.
Absolutely. Now, we talked a lot about the diseases that you would be able to use palliative care for. And my question is there like an age where palliative care is appropriate? Or do you see all age? Because a lot of the diseases we're talking about are diseases we see as we age, but not always. So is age kind of a qualifier?
Really, we treat with Harbor Light mostly 18 and older, but we kind of always kid around and say on any given day, any of us could be.
That's why I'm asking.
For
Absolutely.
palliative care because everyone's tired, everyone has some kind of pain, but basically what qualifies patients, I think, is that they have a chronic illness. There is a disease process going on where their symptoms are coming from.
Okay.
And that's pretty much what would make them eligible for palliative.
And I know Tina mentioned a lot of those diagnoses. Of course, we always hear palliative care with cancer, with, any type of pulmonary issues that you might be seeing. What were some of the other diagnoses you mentioned, Tina? I'm sorry, just to reinforce.
The cardiac issues, people with congestive heart failure, coronary artery disease.
Kidney disease, we deal a lot with a lot of the dialysis
Oh,
centers. in
perfect.
town.
So you can work with a patient who's utilizing dialysis.
Absolutely.
Okay.
The beauty with the palliative program is you're trying to bring comfort, but while the patient is still seeking aggressive therapy. So
Okay.
the palliative program can run right alongside if you are getting skilled therapy, if you're still going to the doctors, if you, if you find yourself going in and out of the emergency room a lot with different symptoms. And most of the time, that's what we find with our palliative patients. It's not the disease process itself that is bringing them to the ER, it's the symptoms.
Sure.
So if you can get those symptoms under control, it kind of can stem, or curtail them going to the ER sometimes.
Yeah, it's amazing. We have a lot of patients with lung disease, cancer, COPD, and it's amazing because obviously when you can't breathe, you become anxious and scared.
Yeah.
And so oftentimes you'll see where they have to end up going back into the hospital or they're calling their doctors or the ER visits. And so, we try to prevent that by helping them at home, by managing that anxiety.
Sure.
And we have patients who, when that is managed, they start to do things that they used to not be able to do. They'll start exercising. They'll start being able to go outside or walk to the end of their driveway, things that they couldn't before.
Yeah, that's a great thing, I'm sure, for your team to see that
It's
we're
very
kind of
rewarding.
regaining some of the
Absolutely.
control over our
Yeah.
daily life. Now, as you're talking and you're telling me about some of the things that you're managing, I'm thinking to myself, if I had a pulmonary issue or cancer or one of those diseases and I was having, problems maybe with shortness of breath or pain, I would call my doctor. So kind of tell me, how does that work? Do you replace the doctor then with palliative care? No. Okay.
Absolutely not. Obviously, the doctor has taken care of these patients for a very long time. They know them very well. So when we do go into a home or wherever their home is, whether it's a nursing home, short-term rehab, or
Assisted living.
Assisted
Yeah.
living. And we see something, we identify, maybe they're having shortness of breath or maybe they're having fevers, whatever the case may be. We then will get in touch with the physician,
Okay.
their physician, and let them know this is what we're seeing, this is what I would like to do. Are you okay with that? Because sometimes there's things they know from taking care of them for so long that we may not know. So we collaborate and then we would implement those orders or the treatment plan for the patient.
So you're working alongside the doctor then, as
Absolutely.
opposed to replacing it. So,
Replacing
and
it.
it sounds like, unfortunately, medicine's evolved so much. And I know a lot of times when I see my doctor, he's running to just see me for those few minutes and then do the charting that's required. And it seems like, unfortunately, the system's made it harder for our physicians to spend time with our patients. So it sounds like you're spending more time with us. So what can we expect to see from your team in the home?
Honestly, we usually see the patient, it's usually a good hour with the patient,
Oh,
if not
fantastic.
more.
Yeah.
If it's a new patient, obviously, it's going to be a little bit more. If there's things going on, depending of, palliative medicine treats from the beginning stages of an illness. So maybe they were first diagnosed to as it progresses. So a patient who is newly diagnosed and there's not a whole lot going on, we may see them every other month. Whereas somebody who is a little bit more advanced in their illness, we will see them, once a month, even more often if needed. If there's something going on with them, of course, we're going to go back and check on them. And we update the physician as well.
And Tina is wonderful because I don't know how many times, she'll call me and say, well, I was checking on Mrs. Jones again today. And usually with palliative medicine, as Tina said, it is, the team consists of our nurse practitioner, who's Tina, and a social worker.
Okay.
And usually each of them see the patient once a month, so that at least every other week you're having a visit from one
Okay.
or the other. But so many times Tina will call me and say, I just wanted to check on Mrs. Jones again today because, we just changed her medication, just want to make sure she's okay.
Yeah.
And that's what's so wonderful because like you were saying, our doctors are really busy and But it's wonderful to have this program where you know you are having somebody, and again, no matter where you live, whether it's a skilled facility, an assisted living, at your own home, you're having somebody come into your home, wherever that may be, at least once a month, and just making sure you're doing okay, just kind of
Right.
checking in between those doctor visits and consulting with your doctor. So it's kind of like you have another player on your side to help out with
Yeah.
those things. But I can, it's a lot of times it's more than once a month with Tina. I mean, she's just very caring about that.
And that's a great problem to
Oh,
have.
it is.
Yeah.
It's yeah. Yes. I mean, I'd want her in my corner if yeah.
Thanks. And we also have, even when, when I don't go out, like say if it's someone who really has been pretty stable for a month or a month and a half, we also have a social worker who goes out. They're phenomenal. They're
Yeah,
also
they do a
trained
great
as
job.
counselors. So they also are checking on them. So really
Good.
every couple weeks someone is checking on them.
Good.
And so many times with the social worker, especially with people who are suffering from chronic illnesses, there's a lot of emotional and psychological baggage that goes along with just
Sure.
suffering through that all the time. So it's wonderful for them to just be able to talk to somebody, especially if it's not a family member, because sometimes our patients can talk to the social worker or to Tina about things that maybe they don't want to talk to their family about.
Sure.
And it just, it really lifts a burden for them. And the social worker also, and they're wonderful. They have, a host of different resources that they can tell our patients about that may be able to help them as well. So it's just, it's a wonderful program.
It sounds that way.
Yeah.
And it's funny because as we're talking, I'm thinking of so many different people in my life that could really benefit from Tina coming out
Right.
to see them.
Yeah.
But my question is how long does palliative care last? Because, there's a lot of different services that are out there and they're very time driven, or so many days that are allowed by insurance, or so many visits. So, how long can someone be on palliative care, Tina?
They can be on palliative care for a very long time. It could
Oh,
be
wow.
years.
Okay.
Oftentimes, the illness doesn't go away.
Right.
So they're always going to be progressing in that illness. So we continue to stay on board. We've had people, for instance, if they had cancer and I was managing their pain, and they recovered from that, there are people who graduate from palliative medicine, which is great. But for the most part, we can stay on.
There's no time limit.
No
Okay.
time limit.
As long as you still need the service. A lot of times, as Tina was saying, she can, maybe for the first few months, she is there once a month, maybe more than that, until they're stable, till those symptoms are under control. And then at that point, maybe she could go to once every other month and then once every 3 months. But it's something that, if something starts acting up again, you just call and we're back.
That's wonderful.
So, yeah, it is. It's just, it's relatively new, but I think it's just really, I think it's making its way, it definitely is such a good service to have.
And I think a lot of people are afraid of the word palliative.
Yes.
Because for many, many years, palliative care was associated strictly with hospice. And it was the fancy
Absolutely.
way for people to talk about hospice without saying that dirty
The
H
H
word.
word,
Yeah.
yes. Yeah.
And
Oh,
so I think that there's a lot of education that needs to be done to make people understand that palliative care comes much earlier in the illness. I mean, even, in the pediatric community, they suggested palliative care for my daughter when she was born. And immediately I went to, what are you talking about?
Right. Yeah.
What is happening here?
Exactly. Right.
And so, can we talk a little bit about that? Like, what is the difference between palliative care and hospice? Where is that line?
There's kind of a fine line, but there really isn't. I mean, it's a very weird, both palliative and hospice are all about keeping a patient as comfortable as possible. But with palliative care, you're still seeking aggressive therapy. You're still treating the illness, you're still going to your doctors, you're still going to go to the hospital if something comes up. You just want to get you just want the comfort so that you can go on with your daily life and hopefully just get, those symptoms under control while you're still treating your illness. Hospice care is more for people who perhaps have already gone, they've already suffered with this chronic illness and maybe they've just decided they no longer want aggressive therapy. So that's really, in a lot of ways, the defining line is if you no longer want aggressive therapy, if you've just decided, I've done all I can for this disease, I'm tired of going to the hospital, there's nothing that can be done, or cancer, where there just isn't a treatment left. When you've decided you no longer want aggressive therapy, that's when hospice comes into play.
Okay.
Palliative is when you are still going to skilled therapy, you're still getting physical therapy, all of those, all of the aggressive therapy basically is really what separates them.
And I know too, hospice has criteria just like all other
Yes.
options that are out there for care. And so this sounds also like a great program, because sometimes there's those patients that I always used to say would fall through the cracks.
Yes.
You didn't meet the criteria for heart, you didn't meet the criteria
Right.
for pulmonary.
Absolutely.
Some of the diagnoses that we used to be able to use to get them in the door, to get them started, are no longer. And so it was always really hard when I worked in hospice to have those patients, because how do we take care of
something.
you? You need something,
Absolutely.
but you're not sick enough for hospice.
And maybe you don't want you
Yeah,
don't
or
want
maybe
to
you're not
give up.
ready.
Yeah, you just you're still fighting that disease, and you're still doing all the things you can to get better, but you've just got all these symptoms, and
Right.
what do I do with all of these? And that's where palliative is just it's just such a wonderful fit.
Absolutely.
And I think one thing that I love about our palliative program is it is truly community-based. So, I know there are palliative programs where you have to go to a clinic, a palliative clinic, or you have to be homebound. With ours, you don't. I mean,
There's
you
no
can,
restrictions
there's no
on those.
restrictions. You can live wherever you are, and our goal is to get you back out, not so.
And what's nice about the palliative program, it doesn't matter if you're in the hospital, or you're at a rehab, or you are at assisted living, we follow along. Because a lot of times we find that people are sick because of they say polypharmacy, or for instance, a patient maybe they were at rehab, and they were having some diarrhea, a little dry, so they stopped that water pill. So then they end up going to another layer of care, another transitioning to maybe back into the home, and they're not on that water pill, and you notice that they're starting to swell up. And so we look at those medications and restart them if need be. So a lot of times that gets missed if you're not following along with the patient.
Absolutely.
Kind of closing that gap.
And I think that that's a huge part, I think, of illness in this country, is that if I have a kidney disease, chances are I'm seeing my nephrologist, I'm seeing a cardiologist, I'm seeing my family doctor, and I might be seeing a plethora of other practitioners. And so you're giving me one pill, he's giving me a pill, she's giving me a pill.
We see that
and
all
even
the
if we
time.
bring our pill list, the nurse or the medical assistant takes that information, but the doctor isn't always reviewing it to realize about interactions, or something that we should or shouldn't be on anymore. And so to have just a singular person
Yes, I
to
always
come
say it's
out
like
and
the
look at the
funnel.
bottles
Yes,
and
exactly.
say, why are you
Why are you
taking
taking
this? This is an
and
old
then being
script.
able to converse with those physicians.
Oh, absolutely.
I was at a senior center one day, and I was talking with this one gentleman. I was talking about palliative, and this gentleman came up to me and just said, I was at my one doctor yesterday, he gave me this prescription, but my doctor last week took me off of it, and it happens a lot of times, and it's no fault of the doctors.
Yeah,
it's just,
absolutely.
It's just
the way
it's just
it is,
the way
unfortunately.
But that's what's wonderful when Tina first visits with our patients. I mean, sometimes, especially that first visit, could be as long as 2 hours,
Oh, I'm
because
sure.
Absolutely.
I always say, while each doctor is kind of treating their body part, Tina comes in and looks at the whole picture and the whole person.
We all need a Tina.
Yeah, we do need a Tina, and exactly, and she'll sit there and just really talk with the patient, see what's going on in their lives, and see what the symptoms are, and look at all those medications, and just kind of try to make sense of it for the patient. And it's just a wonderful thing.
Oh, absolutely.
And not only about the physical with the patients, but the psychosocial.
Right.
A lot of times, we notice that patients, their pain is out of control, and maybe they're anxious a lot, and that's where our social workers come in, because a lot of times figuring out what causes them to be anxious, what are their fears, maybe they have regrets, those kind of things. So sometimes, having them come in, their expertise coming into the homes, wherever their home is, and addressing those that they actually do better and they don't need as much pain medicine or
Sure.
It's amazing how
Isn't
everything
it?
just,
absolutely.
Yeah, well, that's a great resource to have you guys come in and look at that whole picture and figure out, kind of drilling down, how
What's
to
the
make it
cause
better.
of things,
What's
yeah.
the cause, and what do we
Sure.
need to do to make it better? But what are some things that I think people can do to prepare for illness, and what can they expect with some of these flares? Like, what are some of the things that you recommend, Tina, that maybe we can apply before we get you out to the house?
Well, I have to think.
That's okay. I guess first step would be we should just call you, right? Just
Yes,
have you come
I mean,
out and
that-
manage
yeah.
it.
Absolutely.
Yeah, definitely,
Call it, and then usually when I go in to visit, I always find out, like, what do they know? What is going on with them? What do they know about their illness? And then, we always talk about their goals.
Okay.
What are their goals? What can they expect? We always talk about the what ifs. So those kind of things.
And it's a wonderful program because even, it's, and I know people always ask, well, how much is this going to cost me? Like,
Right,
that's
that was
always
gonna be
the
my
big-
next question.
Yeah, and it's wonderful because it's covered by Medicare, Medicaid, most commercial insurances. We always, what we do is we call it running the insurance. We always check the insurance on our patients who want to be on the palliative program. 99.9% of the time it is covered through Medicare, Medicaid, like I said, all the major insurances. And even now, a lot of commercial insurances have a palliative clause. There may be, and I can only think of in the, 2.5 years that we've been doing this, one time where it was somebody who was younger than 65. They were like 58 years old and still working and on a commercial insurance, and they had a minimal copay of like maybe $10 or $15 for the visit. So it's really covered most of the time, and that's one of the big questions we always have. Well, this can't possibly be all covered, and it is. It's it's a wonderful
Well, I'm sure
service.
insurance companies probably view it almost like a doctor's visit.
Yes, it's
It
kind
is.
of under that same, like a doctor's consult visit, yeah.
Okay, so then that leads me to another question then about payment. So, Diane, if you and Tina come out to my home and you make some recommendations, maybe for medications or for some equipment or for medical supplies, then I'm assuming those things are not going to be covered by the program.
No, it would, again, just like a doctor's consult visit, you would still receive all of those things through your insurance.
Okay.
Just as you would if your doctor was prescribing something to you.
Okay. Does the palliative care program help coordinate any of those though? So like if I need oxygen, is that something
Absolutely.
that you're able to do? I know we've run into a lot of problems with oxygen on home patients that don't have services that they feel they need oxygen, and there's a lot of hoops you have to jump through with an oxygen test, and you have to have this pulse ox, and it can be very overwhelming for those that aren't in the medical field to figure that out.
Sometimes it's hard for us in the medical field to figure it out.
Isn't that
so,
the truth?
Yeah.
But that's good to know too, that at least to know that you're the point person to coordinate all these efforts.
Absolutely. If we go in the home and we notice that their oxygen level is low, we will test them. We will do the documentation. We can do the orders and get it all set up for the patient
Fantastic.
through their insurance.
And a lot of times, Tina will, like, for instance, home health agencies, maybe a little bit of therapy would benefit you right now, and we can connect all of those dots for them. So we really try to act as that point person, just to help out with whatever it needs done to make sure that they're as comfortable as possible.
Yeah,
with the
and
services.
I think one of the coolest things that I find about palliative care is that, there are so many services that are available to help you stay at home or to stay wherever it is that you call home. But unfortunately, there's all these parameters of you can only pick one.
Yes, yeah.
So if you are receiving home health, you in most cases cannot have hospice,
right.
and vice versa. And
Yeah.
there's all these like different rules about those home-based community services, and it's so nice to see that palliative care can run right alongside
all of them.
outpatient therapy,
Yeah.
inpatient therapy. If I'm in the skilled nursing home, if I'm assisted living, if I'm home health, whatever my situation is, palliative care can be a
Can
part
be a
of my
part
team.
that, yeah, and it's such a welcome part of the team. I mean, we've just, so many heartwarming stories of patients
Yeah.
that we have just really just helped get back on their feet, and it's just getting those symptoms under control. Because then you feel better, and you can. We have a lot of patients who are going through rehab in different facilities. And sometimes they're not being able to get the rehab, progress in it because they have pain or they have
Right.
anxiety or
Yeah.
their stomach is upset all the time. So you get those symptoms under control. They can continue doing their therapy. They don't
Sure.
get cut earlier by the insurance because they are progressing. And it's sometimes just this vicious cycle because, they're doing the therapy, they're not feeling well, they get cut, they go back home,
Right.
end up back in the hospital.
And that's not good
Then
for
they-
anybody.
No.
Exactly, but with the palliative care alongside the physical therapy, you get those symptoms under control, they're able to progress, they don't get cut, they go home, they feel better, it just helps
break the
everything.
cycle.
Yeah,
Absolutely.
it really does. That readmission rate for nursing facilities that
Yeah.
everybody's worried about, it helps with all of that.
So I have a pressing question for you. When I hear palliative care, and I think what we've mentioned a couple times, we talk a lot about pain management. And so along with pain management comes sometimes, medication that we're utilizing for pain management. And there've been a lot of changes to the laws of how we're giving medications and who needs to see the patient, how often they need to be seen, and what type of, what's the count in the home. And those are good laws that are protecting us.
Absolutely.
But they are creating a lot of red tape for our seniors that are needing these
They're needing
medications.
them.
So where does palliative care fall into that line, Tina? Like, are you able to talk with the doctor and kind of be a part of the process for those prescriptions, or do we still need to go to the pain management clinic on top of the palliative care team?
No, a lot of times, we'll see our patients who are having difficulty even getting to the pain management.
Right, exactly.
So, we do, we visit the patient, we make, our recommendations, or we write the orders for the pain management for 30 days. And then we evaluate them, in a
Perfect.
couple days to make sure that they're doing okay and they're tolerating it. And we also have the behavioral contract. So obviously, if a patient is if the pill count isn't correct, or they're taking medications that were not prescribed
Sure.
by us, then we can, we could stop
See
that.
what you have to do.
Yeah, absolutely. But for the most part, our patients do need pain
Yeah.
medications. It's often, we've had a significant amount of patients who could not even get out of bed.
Right. And that's what I'm thinking is
yes.
there's so many patients that we come across that need those medications for whatever disease process are going on, and then they can't even get in to see a pain management
Absolutely.
specialist. So this would be a fantastic, if that's appropriate, that's a great solution because those patients are very sick and those comorbidities are only becoming worse because
Absolutely.
they can't
Yeah.
manage their pain to get up and see their doctor, take their pills or.
And a lot of times
Absolutely.
taking that pain aspect away from, out of the doctor's hand, not out of the doctor's hand, but just off of his plate
Right,
is a big
alleviating
help to
that.
him.
Absolutely.
Because it's, one less phone call, and we are actually going into the home, so you can regulate it a little more.
Absolutely.
Wherever the patient is, so.
Well, I know we're running out of time. I could talk, like I said, I could talk to you girls
I know.
about this for
All
hours
day,
because
yeah.
I just think it's such a very necessary service. But for our viewers that are interested or have a loved one that they know will benefit, how do we get them a consult for palliative care? How do they go about becoming a part of the program?
You could always give us a call and we could walk you through. Our office is right up on Belmont Avenue in Liberty, but our phone number is 330-759-5270. But basically, all that is really needed is if it's something, we usually just contact the patient's doctor. We get a consult order and what they call a face sheet, just with
Right.
the insurance information and all that. And they send it to us, and within the hour that we get all of that information, we are in touch with the family to set up an appointment and just get everything going. So it's really a very quick and easy process. So they could just give us a call.
Well, I
through
appreciate
it.
you both coming in today and
Thank
telling us a
you.
little bit
Thanks
about
for
palliative
having
care.
us.
Hopefully
Yeah.
this was helpful to our viewers. And if you are interested in learning more about the palliative care program, please contact Harbor Light. Thank you so much, and we will see you guys next month.